Boosting potassium levels may significantly enhance outcomes for patients at heightened risk of ventricular arrhythmia, according to groundbreaking research unveiled at ESC Congress 2025 and concurrently published in the New England Journal of Medicine. In a bold move, researchers targeted high normal potassium levels in their study, leading to a notable reduction in the likelihood of arrhythmias, hospitalization for heart failure or arrhythmia, and death compared to no intervention. This discovery could potentially revolutionize treatment strategies for patients with cardiovascular diseases. Dr. Christian Johns, presenting the POTCAST trial findings, explained the motivation behind the study. Observational studies suggest a correlation between low plasma potassium levels and an increased risk of dangerous heart rhythm changes, while high normal levels appear to offer protection. Our trial aims to evaluate the benefits and risks of targeting high normal potassium levels in patients at high risk of ventricular arrhythmias, equipped with an implantable cardioverter defibrillator, ICD. Conducted at 3 Danish sites, the open-label randomized controlled POTCAST trial enrolled participants with an ICD or cardiac resynchronization therapy defibrillator with baseline plasma potassium levels equal or 4.3 ml/L. Exclusions included renal impairment and pregnancy. Participants were randomly assigned to either a treatment regimen designed to raise plasma potassium levels to 4.5 to 5.0 ml/L or standard care. The primary endpoint encompassed a composite of sustained ventricular tachycardia, 125 BPM, lasting 30 seconds, any appropriate ICD therapy, unplanned hospitalization for arrhythmia or heart failure, and all-cause mortality. Among the 1,200 participants, median follow-up was 39.6 months. After 6 months, plasma potassium levels reached a mean of 4.36 millimoles per liter in the high normal potassium group, compared to 4.05 millimoles per liter in the control group. The primary endpoint was significantly lower in the high normal potassium group, 22.7%, than in the control group, 29.2%. The main driver of this difference was any appropriate ICD therapy, which occurred in 15.3% of participants in the high normal potassium group and 20.3% in the control group. Hospitalizations for cardiac arrhythmias were also lower in the high normal group, 6.7%, versus the control group, 10.7%. Professor Henning Bundgaard, senior author, summarized the results. A treatment-induced increase in plasma potassium level of around 0.3 millimoles per liter significantly reduced arrhythmia burden without increasing the combined risk of hyper or hypokalemia. The benefits were consistent across cardiovascular disease types and methods used to increase potassium levels. Bundgaard added, in several landmark heart failure trials, the improvements in cardiovascular outcomes seen with MRAs were accompanied by increases in potassium levels. Our findings suggest that increased potassium levels may contribute to MRA's positive outcomes rather than simply being a side effect. Considering the implications, the researchers propose that increasing potassium levels to the mid to high normal range could become an affordable and accessible treatment strategy for patients with various cardiovascular diseases at high risk of ventricular arrhythmia.